Yeah. Okay. Can you hear me now? Okay. Do I need to restart? Okay. So my name is Haley Reel. I am a family science major and a minor in legal studies here at the W. My paper today, The Downfall of Women's Reproductive Health, is mainly centered on women that have been affected by the overturn of Roe v. Wade in this previous year. Um, I'm going to be looking at how this case being overturned affects families and gender roles in society, and also how it just affects women in general. So, gender is commonly mistaken as to identify someone's sex, but gender is a social construct used to establish a person's role within society. The right to contraception in medical procedures has been removed in several states and poses a problem for women due to gender roles in society. By looking at the now overturned Roe v. Wade in this paper, I will be an activist for women. This paper will highlight how women's reproductive rights in the United States by providing evidence that encourages men and women to gain an understanding of how gender roles within the United States affects women, but especially those who are already marginalized. Roe v. Wade is a court case from 1973 that recognized the right to personal privacy, including the right to choose an abortion or not. This court case became one of the first to allow women the right to terminate their pregnancy without the approval of their husbands. Not only did Roe v. Wade make history in the medical field, but it also made history among families for years to come as men and women were able to discuss reproductive health and contraceptives prior to marriage. For decades, women's reproductive health has been protected under the court case ruling of Roe v. Wade. It allowed women to terminate a pregnancy as a form of health care based on their trimester alone. Roe v. Wade gave women the right to choose and the right to their own privacy. The right to privacy and the ability to terminate a pregnancy can have a significant impact on a person who has been a victim of a sexual assault that results in a positive pregnancy test. Prior to the overturning of Roe v. Wade, women would not be forced to bring to term a pregnancy from a rape or sexual assault. Women did not have to be victimized twice by their assailants. However, a case in Mississippi brought major attention to reproductive rights by implementing a 15-week limit on a decision to terminate a pregnancy due to rape or incest. This case, Dobbs versus Jackson's Women's Health Organization, along with the overturned Roe v. Wade, removed the protection of women's rights to choose privacy under the U.S. constitutional law. Dobbs v. Jackson opened the door for other states to restrict women and medical professionals from terminating a pregnancy beyond 15 weeks, when previously it was 24 weeks. The change in the timeline negatively impacts victims of rape or incest, as a pregnancy may not be immediately detected and a procedure may not be available, further complicates the ability of a person to make a timely and sound medical decision. Not only does pregnancy affect women, but it also affects the medical professionals who are entrusted with the health and well-being of individuals in our communities. Medical professionals who practice within Planned Parenthood clinics have lost their jobs within states that no longer recognize the physical and emotional health of a pregnant woman. Medical personnel who once offered women a choice to decide whether to terminate a pregnancy due to medical reasons are harassed. Under Senate Bill 4 in Texas, doctors could be jailed and fined up to medical reasons. Oh, I'm sorry. Under Senate Bill 4 in Texas, doctors could be jailed and fined up to $10,000 for terminating a pregnancy, even within probable cause of a medical emergency. Doctors are now hesitant to see pregnant patients who are experiencing early pre-labor symptoms that could possibly terminate a pregnancy, while other doctors are referring patients out of state for treatment due to fear of losing their medical license. For example, a study between two hospitals investigating the rise in mortality rates among pregnant women found that 57% of patients in these Texas hospitals had a serious risk of maternal morbidity due to preterm premature rupture of membranes. Preeclampsia with severe features or vaginal bleeding, compared with 33% of patients who elected immediate pregnancy interruption under similar clinical circumstances in states without the pregnancy termination legislation. The question remains then, Why are pregnant women not given the choice over their reproductive health? To answer this question, we first have to examine why there is governance over the reproductive health of women and not men. From the time we are born, families encourage their children to follow stereotypical gender narratives and societal norms. Little girls help mom more with housework, while little boys help dad with the yard work and on vehicles. Children grow up imitating what they see in person and in the media. Therefore, boys see their masculine dads working outside and not helping with house chores, and they grow up to mimic this behavior of not wanting to help with mom with housework. Little girls are conditioned to be housewives by being quote unquote mommy while playing dolls and are told to care for their quote unquote baby dolls. Women are brought up to be mothers, but not all women can be or want to be mothers during peak reproductive years. Women may value their educational goals and a desire to pursue careers before transitioning to married life or having children. Women can access contraceptives to prevent pregnancy, but contraceptive is not always foolproof or available to all women. Planned Parenthood clinics being closed restricts low income women, colored women, and immigrant women's access to contraceptives and forces women to look for unsafe ways to have an abortion. A study from 2021 also noted that the number of childless couples in the US will continue to increase as more adults are more likely to choose not to have children. Sometimes pregnancy is not by choice. In the United States, women who are more prone to a higher pregnancy mortality rate are abused women and women of color. Intimate partner violence is described as actions that are done to cause physical harm to another within the relationship. Women that are in the IPV relationships can be molested by their partner and left with an unwanted pregnancy. Men are also much more likely than women to rape or murder their partners. These women are now subjected to carrying and raising their attackers' children. The risks to the child are also higher as the child may grow up to be neglected due to the mother reliving her attack when she tries to care for her child. The choice to terminate a pregnancy due to rape may not be possible if the woman finds out she is carrying a child beyond the 15-week time period, or if she is unable to demonstrate that the pregnancy is due to a rape. This can be a complicated situation for women of color as their rapist could be their partner, and therefore the act of the rape may be harder to prove when intimate partner violence has been part of their relationship. Additionally, our gender roles can also impact how institutions view the act of rape when IPV is present. For example, a study notes that some relationships may experience gender power inequality when women feel they are unable to vocalize their needs because they fear their partner will harm them. The narrative of gender inequality is not isolated or rare. Many of the states adopting bans on reproductive freedom of choice are located in the South and Midwest, where low-income women, women of color, and immigrants are left with no way to assess a safe and legal choice for pregnancy termination without traveling out of state to reach an abortion safe haven. Women of color are more likely to live below the poverty line and in states such as Mississippi and Louisiana. There is already limited access to health care among low-income communities. These communities also experience shortages of contraceptives, which also prevent women and men from obtaining proper health care options. While Planned Parenthood clinics used to be places where people of low income and minorities could get reproductive health care, the same policies that impacted freedom of choice are also impacting access to basic reproductive health care. A study alludes to the difference in pregnancy mortality rates between different ethnicities in the following. In 2022, Black women are over 3 times more likely than white women to experience a pregnancy-related death or severely morbid event during their pregnancy and postpartum period. The lack of access to adequate health care is not just a problem for men and women, it is a social problem when individuals lack choice. In conclusion, women deserve the right to make their own decisions regarding reproductive health and well-being. While the ability to terminate a pregnancy is no longer a protected right under Constitution, the Constitution does state that U.S. citizens have the right to liberty and the pursuit of happiness. Then why are women not given the right to pursue happiness by choosing when to begin planning for a family? Why are women not given to have the liberty to choose how to manage their reproductive health? All women deserve the right to live without fear of being raped by their partner or a stranger. All women deserve the right to live without, I'm sorry, all women deserve the right to terminate a non-viable pregnancy that can kill them or carry a baby to term only to die upon birth. Men and women in the United States are not equal within society. Women will not be silenced. Our voices will be heard. Life, liberty, and the pursuit of happiness is a fundamental right for all people. Thank you.
Good afternoon. My apologies if I kind of come off a little hoarse today. The famous Mississippi Springs finally gotten me, so my voice keeps trying to go away. But my name's Haley McCool. I'm a junior this year. Last semester, I was in a class, FSC 351, Women's Experience. And our final that we worked through the entire semester was this paper that I'm about to tell you all about. I chose to advocate for women's choice and their bodies and their voices to be heard in decisions regarding themselves. For centuries, there's been an ongoing battle in reproductive rights all across the United States, not just here in Mississippi. But many believe that women should have the right to choose. It's not always heard. It has always been men. Men have had, in the past, have had control over women's reproductive rights and choices, and many groups argue about what is right and what is wrong. But who is winning? Research has shown that sexism and male ideology is one of the main driving factors behind this devastating injustice. Other driving factors include, but are not limited to, misinformation, politics, and the pandemic. When she didn't give you the clicker, I thought she was going to stay over there. No, I don't think it is. Wait, not so. Okay, sounds like a deal. So, the overturn of Roe v. Wade affected me as it did most women. It just felt like a devastating injustice to everyone. They gave us no choices. It just felt like a horrible step backwards. My mom used to work at the women's clinic in Starkville, and I remember up until that point, I didn't understand why anybody would want to have an abortion, why no one would want to have their baby. But my mom came home crying one day because she had to deal with a woman whose baby would never live. It had no brain. And that woman had to drive all the way to Oklahoma just to get an abortion because nobody would see her about it. In the days after the overturn of Roe v. Wade, one of my friends that I worked with, she had a miscarriage, didn't know she was pregnant. She had her miscarriage in her bathroom and went to the ER that night. They told her that everything was okay. She'd passed the baby. She didn't. She had an ectopic pregnancy and they missed it. But because there was no clear indication of what to do, the doctors were reluctant to have the procedure to fully abort the rest of the fetus. Luckily, she still had the surgery, but it was near death. She almost died because they waited too long. They were just trying to make sure that they weren't going to get sued. And I can understand that you worked so hard for your degree, but her life was almost the cost of that. So I want to start with what is Roe v. Wade? Before Roe v. Wade was established, many women still risk their lives to receive abortion, as many as 1.2 million a year, by using methods that were unsterile, unsafe. It killed many of them, and the rest were usually maimed for the rest of their life. Roe v. Wade was established in January 23rd, 1973. It ruled that any laws which banned or withheld abortion were an infringement on the constitutional right to privacy and stated that any woman or woman had the right to terminate a pregnancy. However, it's more than just abortion. everyone hears it and just immediately goes to abortion, but it's so much more than that. It's the right to contraceptives, it's the right to privacy, and it's the rights to just reproductive health in general. Even though Roe v. Wade was a major win, it did not guarantee that a woman could just walk into a doctor's office and receive an abortion. It just meant that we actually had a chance to. Until 1992, Roe v. Wade followed the trimester system. This was where a woman could consult a physician and receive an abortion at any point during the trimester for any reason, during the first trimester, I'm sorry. The states then could regulate the rules as they pleased about abortions during the second and third trimesters, where many elected that abortions taking place during this time could only be done if the woman or the fetus was at risk of dying. The trimester system was abandoned in 1992. The court decided that states could restrict abortion before viability. The only restriction to this new ideology was that the states could not prevent a woman to have an abortion if the fetus was not viable or if she was at risk of dying. This was the first step that I found, anyway, that laid the nail in the coffin for Roe v. Wade. And as I discussed earlier, it didn't stop every woman. That woman did have to drive all the way to Oklahoma for a baby that would never live. On my history slide, I have a timeline going, and I have a lot of different pictures from each of the timelines I chose. But I really wanted to stop and talk about this one at the beginning, the 1820s, because I did more research on this picture and I found it very interesting. It's called, it's probably really hard to read, but it says underneath here, it says the female abortionist, and it's a woman with a devil eating a baby. This was propaganda, but she's a real woman. This was published in the National Police Gazette on March 3rd, 1847. Her name was Anne Tro Loman, sorry. Oof. She was also better known as Madame Restel. She was British-born American, and she was an abortion provider who practiced in New York during the 1800s. She was known all over the country for her concoctions that would cause miscarriages and her surgeries to help prevent and end pregnancies. Abortions were hardly legal illegal at her time. It wasn't really until the 1850s and right here at the 1820s that we started to see restrictions or any sort of trying to think of the word. We just really didn't see any sort of restriction or blocking of these services until the 1820s leading up to the 1850s when the laws for obscene material and media were constructed. She was arrested many times before the main arrest that I'm going to talk about, but she was arrested for the last time in 1878. She was arrested by Anthony Comstock, who posed as a man requesting birth control pills for his wife. At this time, she was very old and her husband had just passed away. People described her as anxious and hopeless during the days leading up to the beginning of her trial. The morning her trial was start, one of her maids found her lifeless body in the bathtub of her home. She had died by suicide. She'd rather just go out on her own terms than live the rest of her elderly life in prison. And I just wanted to point that out because it was a very interesting story when I looked up more into the picture. But as you can see, in the 1820s, we start to see our first legal restrictions to terminate pregnancy. And then by the 1810s, almost every state had some sort of restriction on reproductive rights and abortions. By 1973, as we talked about, the Supreme Court rules in favor of Roe v. Wade. But by 2020, COVID begins, and so does the discussion of overturning it. By 2022, the Supreme Court officially overturns Roe v. Wade. And now, in 2023, we see a major imbalance between males and females. The more I looked into this power imbalance, the more I realized that these three things were really the cause of it. The COVID-19 pandemic, the overturn of Roe v. Wade, and sexism in general. I hadn't really heard anyone talk about sexism, but the more I did research into it, it really was one of the main factors. In March of 2020, 3 state governors, the governors of Alabama, Texas, and Ohio to be exact, suspended women's access to abortion services, arguing that abortion was not a necessary procedure and the country needed to save as much medical supplies as possible. They were soon to be followed by other states such as Iowa, Mississippi, and Oklahoma, who used the pandemic as an opportunity to terminate abortion rights. States also used the CARES Act to their advantage by finding loopholes to avoid funding Planned Parenthood facilities during such a pivotal moment in history. The CARES Act was designed to fund businesses and programs that may not have survived the pandemic or have been able to provide services to those in need. Because some states ignored Planned Parenthood's needs during the pandemic, there was a lack of affordable contraceptive and reproductive care during the pandemic. This impacted the Black and Latinx women the most. Their communities were already at such a high risk of dangerous and unwanted pregnancies. COVID-19 also caused a spike in domestic violence and murder and reproductive violence as well. 25% of women living in the United States have been physically attacked or beaten by their intimate partners. Even worse, 34% of these women worldwide are murdered every year by their partners as well. Global collected data during the time of the pandemic suggests that social distancing and shelter-in-place mandates and practices accidentally increased negative consequences relating to sexual and domestic violence involving women by increasing these feelings of tension and isolation in the home. Many women were trapped in these situations because of lack of social services available during the pandemic. New York was hit the hardest with an increase by 30%. Common places for large spikes such as the spike increase recorded in New York were usually basically suburban and metropolis areas. Women who are victims of domestic violence often experience complications while pregnant. These complications can be low birth weights, neonatal death, and preterm delivery, but there's plenty of others that can happen. And like mentioned earlier, since Planned Parenthood really wasn't around and they were one of the main places you could go to that didn't cost an arm and a leg, there wasn't much these women could do. The overturning of Roe v. Wade hurt women all over the country. It felt like a step backwards rather than a forward. We've already discussed Roe v. Wade today, but there's so much more it's just so much more than abortion. And that's just something that people don't seem to understand and why it is so pivotal that it was just so important not to have overturned. It really just was. Through my research, I found a lot of things that were not horribly shocking, but shocking nonetheless. Research suggests that men enjoy structural power over women, and that is why men put women down. Men throughout history have seen women as the lesser sex and have manipulated their dominance in positions of authority to exert themselves at institutional levels. This is the reason men dominate in areas such as politics, religion, and the medical field. An example of men holding institutional power over women and their bodily autonomy would be the American Medical Association and the medical field more broadly. The AMA was established in 1847, but did not see its first female member until 1876. Following the development, it would be nearly 100 years in 1969 when a woman would be elected to a position of major authority in this institution as vice president. There would not be a female president until 1998, when Dr. Nancy Dickey, the first female board chair, would be nominated. As a result of this female absence, men were given vast control over the decision-making process and medical ethics, handing them the keys of power regarding women's right to choose whether or not to carry a pregnancy to term. In fact, women were broadly denied access to mainstream medical education until before the 1890s. In the year 1893, 3 women were attending Johns Hopkins Medical School. By 1974, women only made up 22.4% of medical school entries. This number grew to 45.6% by the end of the 20th century. The only issue is that by this point, men had already established policies and ethical codes that would take years to change. This unfortunate situation has led to medical mistreatment or insensitivity regarding some of women's most personal issues. Men are also more likely to use gender intimidation to exert control and power over women. Men have also over-sexualized women, which gives them a false sense of consent. Many women have found themselves victims of sexual harassment, as well as gender violence, sexual assault, and gender-based murder because of these sexist ideologies that have given men so much power over them. Males use sexism to control and dominate women, and it does not stop at abortion either. Men have control over several other aspects of women's reproductive decisions, such as childbirthing procedures, medical screenings, and intervention during pregnancy. Reproductive violence can be linked to the male drive for power, as well as forcing women into motherhood before they are ready or willing. Studies have also constantly shown that sexism highly associated with negative beliefs about abortion and is often support of several restrictions and laws about women's reproductive health and reproductive autonomy. Men typically argue that they are trying to protect the fetus, and some even have the mindset that they are protecting the woman and her womanhood expectations by forcing them to carry an unwanted baby to term. Another group of men that I've discovered through my research, who call themselves men's right, argue that the feminist ideology has disempowered men, and they believe that by overshadowing women, they will regain their power. No matter how one looks at the situation, it is clear that sexism has played a major role in undermining women. I chose to advocate for women's reproductive rights because 75% of women seeking to terminate their pregnancies are living each day paycheck to paycheck. They are surviving at the federal poverty line and cannot afford to bring a child into this world. Why should they be forced to bring a baby into the world when they cannot even take care of it? Why force an unwanted pregnancy? Just so that the baby can grow up in a world that only cares about them until they're born? That was a argument my friend used one time, that we are living in a society that only cares about children until they are born. And then they are forgotten about in this broken system. Nearly 1 out of every 3 women who have had experience with the United States foster care system will experience reproductive coercion at some point in their life. This just continues the cycle of unwanted pregnancy and strains an already overburdened foster care system. Something women can do to fight the system is to continue to speak up and demand change. By speaking up, women are saying that they will no longer allow the male sex to control their body and access to reproductive services such as abortion and contraceptives. Women also need to raise awareness about the misogynistic ideology that has been allowed to abuse them for so long. Raising awareness would help women show that they are no longer going to sit by as men continue to use gender intimidation to exert power over them. Women should also urge lawmakers to stop passing laws that will harm women in their fight for reproductive rights. Following the last suggestion, another thing to push is the approval for the equal access to abortion coverage and health insurance. It's called the EACH Act. The EACH Act has been proposed and introduced, but has failed to move out of the House or the Senate at this time. If the EACH Act was passed, it would lessen some of the cost and barriers between women and abortion. It would require public health insurance to include abortion care and mandate that federally supported health facilities provide care. EACH would also stop states, local, and private insurances from not covering abortion services. Lawmakers should also turn their attention to minority women to ensure that they are not cut off from resources since, as discussed earlier, they are at a higher risk than any other group. Ooh, I think something cut out of my, oh yes, no, I'm there. Sorry, I'm having a day. I'm just going to start from the beginning for that one. Lawmakers should turn their attention to minority women to ensure that they are not cut off from resources since, as discussed earlier, they are at a higher risk than any other group and suffer more from barriers while trying to access help, more so than any other group. Finally, healthcare, contraceptives, and social services should be more readily available to women. 1,460 women in the United States are murdered or suffer from fatal injuries because of domestic violence by their partners every year. Many more suffer from reproductive violence. By providing more resources, women can escape situations from abusive partners who might use domestic and reproductive violence to keep them trapped in relationships. As also easier access to contraceptives and abortion services such as Planned Parenthood would help lower the number of unwanted pregnancies that occur in the United States every year. For too long, the United States has caused injustices to hundreds of thousands of people of various ethnicities, genders, sexualities, and cultures, but they continue to let one group down, a group that makes up half their demographic, women. United States women are living in a society that cares more for a fetus than for the unprepared mother, the rape victim, the teenager, the domestic violence victim, etc. Women are living in a society that tells them that they cannot get an abortion and that abortion is murder no matter how or why the justification is. Society has failed women in the past, but through advocacy and activism, the future does not have to be the same.
We will now open the floor for any questions.
Oh, okay. Oh wait, probably shouldn't go. Now that we're at this predicament where Roe v. Wade has been overturned, and as for right now, we're not seeing it being reinstated. Do you propose any maybe alternatives to better women's health care?
Well, as I stated at the end, the EACH Act is definitely one that's a good option. And just advocating and activism in general are really good. Just making sure that we're heard in general is going to help us in the end.
Yeah, I agree. Education is the biggest thing, like Haley McCool stated in her PowerPoint, that a lot of people don't understand that the overturn of Roe v. Wade is not just about abortion. It's about women's healthcare in general and how we are not listened to as a demographic of the population. So yeah, history repeats itself, and I would really hate for it to repeat itself here. So we need to be more educating instead of criticizing people.
Any more questions from the floor? Do we have any in the live stream?
I do. Hey, how are y'all? Can everybody hear me?
Yes, we can hear you.
Thank you. First of all, I want to say good job on the presentations for both of the participants. But I do have a couple questions. I guess my first question is, did anybody in their research see anything versus, I know we're talking about women's health, but specifically when you mention abortion, do you see the difference in elective versus spontaneous abortions and the percentage and the statistics that are recorded with those? And then what are the statistics? So my second question, like the statistics with the partner violence, and do you know what those statistics are? Like how many of those abortions have been out of those statistic wise?
I unfortunately did not include that in my paper. I did run into spontaneous versus the planned abortions. And there really wasn't that many that were getting spontaneous abortions. It was more so like planned out. Just it wasn't like I made a mistake, here I am. It was more so I'm in the situation, I don't know what to do. I have some of the domestic violence issues written in my paper. Sorry. I said them when I spoke. I can probably find them real quick, to be honest, because I have it highlighted. Where is it? I just have that 25% of women living in the United States have been physically attacked and beaten by intimate partners. And that's a pretty good percentage right there. I don't have the current percentage, but that was during COVID. And then 34% of women worldwide are murdered every year by their partners. That was also during COVID. But as for current stats, I don't have any.
But we don't know how that's related to abortion topics. Like how many of those percentage of women had an abortion because they were a victim of rape or incest or
I really couldn't. Yeah, as Dr. Brooks is saying, there really wasn't any.
good.
Especially
That's okay.
I was looking for.
Good, good. Thank you.
One thing that I did want to reiterate, regarding your question, I have this quote in my paper. It says, Black women are over 3 times more likely than white women to experience a pregnancy-related death or severely morbid event during their pregnancy. And I probably should have been more, what's the word? I guess I should have said more like it's because of intimate partner violence and just because they're not getting the proper health care that they deserve because of their race.
Good deal, good deal. Thank y'all.
No problem.
Do we have any more questions? Well, since there are no more questions, I would like to thank you all for coming to the final presentation of today. And now I will turn it over to Ms. Hillary.
Thank you to the presenters in this panel and in previous sessions. For our students and our faculty evaluators, we have a reception that I think is slated to start in about 15 minutes, but I've been told that it's set up already. So you may make your way to that room if you'd like to enjoy yourselves and decompress and congratulate yourselves for the hard work that you've done, not just today, but leading up to today. And thank you to all of our faculty who are here as both mentors and evaluators, and your classmates who are here supporting you. This is sometimes a nerve-wracking day, would you say? And your support means a lot. So thank you all. And this concludes the 2023 Undergraduate Research Conference. So good job. Thank you.